Yeah, so guys, good morning. Today we are going to look into the gastro pharmacology. Okay, so the medicines which we are using in the gastroenterology. So first classification of medicines in the gastropharmacology. Okay, guys, the gastropharmacology. And the gastropharmacology, first type of medicines are antiemetics. Simple. The antiemetics. Okay, so the antiemetics are given for what? For emesis, right? For vomiting, we'll give the antiemetics, right? Now, what is the main action? The main action is that it decreases the CTZ sensitivity. It is chemoreceptor triggering zone sensitivity. Okay, it decreases the chemoreceptor triggering zone sensitivity. That is action of antiemetics. Clear? Now, we can have vomiting. We may have vomiting at different stages. So we shall see at which are the stages at which we can use these antiemetics. So the first one is the centrally acting antiemetics. Okay, centrally, this there is a problem with this uh, writing. Okay, it's centrally acting antiemetic. So centrally acting antiemetics. Can anyone give me an example for the centrally acting antiemetic? Niveda, what is the give me an example for this, for the centrally acting antiemetic. Or give me any medicine that you know about this anti in the classification of antiemetics.
Injection emissaries, sir.
Yeah, fine. So this injection emicet as a injection emicet or the ondansetron, that is a centrally acting antiemetic. Okay. So here we have the emicet. Okay, thank you. So this is the centrally acting a drug, centrally acting antiemetic, emicet. And second example for the centrally acting antiemetic is um, this prochlorperazine. Your prochlorperazine. Okay, prochlorperazine. This is a second antiemetic. Okay, second centrally acting antiemetic. Second centrally acting emetic. Okay, so that is first classification of antiemetic, centrally acting one. Now, in the second condition, so we have a centrally acting antiemetic. Next is for the motion sickness. Okay, you know the motion sickness when you are traveling in the bus or in any vehicle. If you are traveling, you may have a, a chance of vomiting. That is known as a motion sickness condition. So for the motion sickness, so there is no point in giving antiemetic or chlorperazine when you're giving this when you're traveling. Okay, because that is the problem with your ear, right? See, the centrally acting antiemetics directly act in the vomiting center which is present in the brain. Okay, but motion sickness is not like that. See, I'll explain what is a motion sickness is. See, this is your ear, right? So inside your ear you have this ear canal, the eardrum, the malleus incus and stapes, and which is connected to the cochlea, right? This thing. Okay, this is the tubes. Okay, you remember this thing, right? So inside this cochlea, okay, inside this cochlea, it is a round shape. It's a structure like this, right? It's a it's a coiled structure. See, when we open this coil structure or when we elongate the coil structure, we'll get a tube-like structure. Okay, in that tube-like structure, there are a lot of compartments or pockets available. Okay, so in these compartments of pockets, there are microscopic hair-like structures. Okay, so the microscopic hair-like structure. See, this is suppose we'll take the microscopic hair-like structure. On this microscopic hair-like structure, there is a protein. proteinous substance like this. Okay, in every microscopic structure, you'll see a proteinous hair structure like this. Okay, so now suppose this is your head. Okay, this is your head. When your head is tilted to this side, okay, when you tilt your head to this side like this, okay, when you tilt your head like this microscopic structure will move this to the opposite direction like this. This is the hair like structure, but this will be moved like this. Okay, now when once your head is tilted to the opposite direction, okay, when your head is tilted to the opposite direction, the same microscopic structure will tilt it in the opposite direction. See, like this. Got it? This is how the ear is maintaining the balance. Okay, this is how the ear is maintaining the balance. Right. So what happens in motion? If you are in the motion, if you are moving, especially in a bus, okay, so what happens? The head will be always moving. There will be a jittering into your head. Okay, the head will be spontaneously moving. So this movement will make this hair-like structure to disturb its balance. Okay, once the ear's balance is disturbed, okay, once the ear's balance is disturbed, you may feel nausea and further vomiting. You got it? So this is how this is how you can have a vomiting when you are moving in the motion sickness. Okay, so have you heard about the tablet Evomin? Evomin is a tablet which we'll take for the motion sickness. It is nothing but your promethazine. Okay, promethazine is the tablet. Or you can have this is the tablet, okay, promethazine. Or you can have maclizine. So these are the two tablets for motion sickness, promethazine and maclizine. Clear? Okay. Next one. Next antiemetic is gastric emptying agent. Your gastric emptying agent. Gastric emptying agent. Okay. See what happened is as the name itself indicates, this is your stomach, right? So inside your stomach there will be food particles, right? You have eaten the food particles. So you feel vomiting because the stomach might be full. One condition, okay, or the digestion is not properly taking place. Second condition, or you might have slept after having a heavy food. So in many conditions, the food particles which will be present in the stomach won't move to your intestine, or there will be increased hydrochloric acid in the intestine. So in such conditions, you may feel vomiting. Okay, so in that condition, we will help the patient with emptying of your gastric content. Okay, so the drug which we give is that metoclopramide. Okay, metoclopramide or your Reglan. Reglan is a drug. Metoclopramide. Guys, uh, in pregnancy, the pregnancy vomiting, pregnancy induced vomiting, or the lady hyperemesis. So simply the word is hyperemesis. So which is the drug? Hyperemesis. Is it Emicet or Reglan? Which one? Valerasu, which is the drug which we are giving? Emicet or Reglan in pregnancy induced hyperemesis gravidarum?
No, sir, no idea, sir.
So regular.
Niveda, Reglan. Why? 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 Any idea why we are giving Reglan?
No, sir.
Jayesha, Jayesha, you have any idea?
No, sir. I know the tablet, but I don't know why they are used.
Okay, fine. See, kindly understand this. In hyperemesis gravidarum, or usually in the first stages of pregnancy, in first trimester of pregnancy, Emisset is contraindicated. You should not give emisset to the patient as as it induces the risk of BB being born with cleft lip or cleft palate, or otherwise the patient may have the baby may have a respiratory problem. Okay. See, kindly note, emisset is not safe in pregnancy because why it is not safe? Why we say it is not safe? Because it acts on the blocking the natural hormone serotonin. Okay, it blocks the serotonin in case of pregnancy. Okay, and in further cases, it may leads to cleft lip or cleft palate or any respiratory problem, or it can also cause miscarriage or preterm delivery. Clear? So this is why we are suggesting metoclopramide for hyperemesis gravidarum. Okay, kindly note this. This question have been asked multiple times. Clear? So this is about your antiemetics. Clear? This is about your antiemetic. So we have done the centrally acting antiemetic, we have the motion sickness, we have the gastric emptying agents. So these were the drugs that comes under the antiemetics. Clear? Next, what are the main side effects? What are the main side effects of these antiemetics? See, since it is centrally acting, okay, since it is centrally acting, it causes CNS depression. Okay, it causes CNS depression. Then, since again it is centrally acting, it may cause a drowsiness. Okay, it may cause drowsiness. Again, since it is centrally acting, it may lead to dry mouth. Okay, so these are the main side effect of your centrally acting antiemetics or any antiemetics. Usually for the centrally acting. Okay, emeset. Now the second drug. The second drug is anorexians. What is anorexians? See, anorexians means what is anorexia? Anorexia is what you don't feel the need for taking food, right? That is anorexia. Patient is not taking food. So there are some drugs that causes the suppression. Okay, so anorexians are the drugs which causes suppression of the desire for food. Okay, this drug will suppress the desire for food at hypothalamic center. Okay, suppress the desire for food. So the patient, after taking this medicine, this patient won't feel of taking food. The suppression for obesity management, we'll give anorexics. Okay, at the hypothalamic center. Examples are amphetamine. Don't bother. This question won't be asked. Anorexians won't be asked. Okay, but, because it is not usually used for every patient, and there are some contraindications for these medicines. So it is not asked. Since it is under the cardiac pharmacology, I'm explaining it. Anorexians. Okay. Third classification. Third one is antacids. Guys, in the class, I have uploaded the uh, the anatomy and physiology of the clinical sectors. So kindly read it once. Okay. It will be very beneficial for you. If you don't know the proper anatomies and physiologies, when you read that textbook, it will get you help with this, how it is clinically correlated. Okay. Third one, the antacids. So what do you mean by antacids? See, the stomach will be producing acids, right? The hydrochloric acid will be produced by the stomach. See, if you are having such kind of problem, we'll give the proton pump inhibitors, right? So what is the function of proton pump inhibitors, PPAs? This proton pump inhibitors like omeprazole, right? This omeprazole will decrease the production of hydrochloric acid. Okay, it will decrease the production of hydrochloric acid, but it doesn't cause any change in the already presented hydrochloric acid. Okay, so your stomach will be full of hydrochloric acid. If you are taking the proton pump inhibitors, it will decrease the production of hydrochloric acid. But if a patient is having severe gastric pain, or if a patient is having severe epigastric pain, right, we can give injection pantoprazole for this patient, which means further the hydrochloric acid won't be produced. But what happens to the already produced hydrochloric acid? It has to be neutralized, right? Once it is neutralized, then only the feeding of the GERD as well as this epigastric pain will be decreased. So along with giving this proton pump inhibitors or the paras or the pantoprazole, you have to give the antacids also. This antacids will act and it will neutralize. Okay, it will neutralize the gastric acid. It will neutralize the gastric acid. Clear? It will neutralize the gastric acid. Which are the examples? The examples are aluminum hydroxide, right? Magnesium hydroxide. So what happens? This aluminum hydroxide will combine with the hydrochloric acid and it will give what? H2O plus aluminum chloride. Okay. Likewise, the magnesium hydroxide was combined with the HCl, will combine with the HCl and give magnesium chloride plus water. Okay, thus this aluminum hydroxide and magnesium hydroxide will neutralize the HCl. Okay, and what is the main side effect of these antacids? What is the main side effect of these antacids? It may leads to constipation. Okay, it may leads to constipation and also a decreased absorption. It may leads to constipation or decreased absorption. Why decreased absorption? See, for the absorption, the hydrochloric acid important, right? So we have studied yesterday the food. When we were talking about the food, we have studied the food. What all the food that we eat, it has to be neutralized and it it has to be absorbed. Like it will be combined with your hydrochloric acid. Once the food is combined with the hydrochloric acid, then only the proteinous substances or the protein enzymes will be activated. If there is no proper hydrochloric acid present, it will lead to decreased absorption. Clear? So that's about the antacids. Fourth drugs are anticholinergics. Anticholinergics. See, anticholinergic, what is the main function? It inhibits the smooth muscle contraction in the GA. Okay, kindly note this. It inhibits the smooth muscle contraction. See, all the gastrointestinal system, the duodenum, ileum, jejunum, the intestine, entire intestine, or the associated muscles around it are smooth muscles, which means those are involuntary muscles. We don't have any control on this. Okay, so the smooth muscles, it inhibits the smooth muscle contraction. So you remember when we were studying this muscles, we have studied skeletal muscles as well as smooth muscles, right? Skeletal muscles are those muscles which we can control, and smooth muscles are those muscles which we cannot control, right? So anticholinergic. Can anyone give me an example for anticholinergic? Jesha,
Sir,
yeah, example for anticholinergics. Sali, can you give me example for this anticholinergic?
Not remember, sir.
Anu,
Ipratropium.
what?
Ipratropium.
Ipratropium. What is ipratropium then? What is the action of that?
Smooth muscles.
Mm-hmm.
I don't know.
What it is? What it is used for? My
It's
dear,
used
you are
for
correct. You are correct. Just continue.
bro- bronchial smooth muscle. We have
Yeah,
studied
fine.
in
Yeah,
respiratory pharmacology.
yeah, fine. Very good, very good. At least you remember that. Ipratropium, it acts on the smooth muscles. Fine. For it is so it is given for asthma as well as emphysema condition. Fine. Ipratropium is an this anticholinergic drug. Very good. So I was expecting you to say atropine. The highest use anticholinergic is atropine, right? So atropine is an anticholinergic. And again, we can give this dicyclomine, the cyclopam, dicyclomine. Okay, so these drugs are given for the given as an anticholinergic drug. Okay, see, the dicyclomine. If a patient is complaining about an abdominal pain, okay, so we know that this if any patient complains about the abdominal pain, in 80% of the condition, it won't be related with the skeletal muscles. Okay, it will be related with the smooth muscles. That's why we give cyclopam tablet or the cyclopam dicyclopam injection to the patient so that it acts on the smooth muscles. Okay. So the main side effects of these anticholinergics are it is all related to decreased PNS stimulation. It causes decreased PNS stimulation, parasympathetic nervous stimulation. It causes decreased parasympathetic nervous stimulation. Okay. So that is the main side effects of these anticholinergics. Okay. Now, fifth classification. Fifth medicines are anti-secretory agents. Anti-secretory agents. Anti-secre Anti-secretory agents. Okay. So this one will inhibit the gastric acid secretion. Okay. It will inhibit the gastric acid secretion. It inhibits the gastric acid secretion. Like examples are H2 receptor antagonist. Right, H2 receptor antagonist. So Randac, cimetidine, famotidine are the examples. But now Randac and also or all these things are banned in India also. PPI, proton pump inhibitors like omeprazole, pantoprazole, rabeprazole, all those things are which comes under the proton pump inhibitors, which will decrease the secretion of hydrochloric acids. Fine. Next, sixth drug is anti-diarrheal drugs. Anti-diarrheal drugs. Anti-diarrheal. What is that? It decreases the what movement of the intestine. Okay, so slow passage and formation of the stool. That is the main function of the antidiarrheal. It will decrease the movement of your intestine, usually on the large intestine. Okay. Now, antidiarrheals. What are the classifications of antidiarrheals? First classification of antidiarrheals are fluid absorbent. Okay, fluid absorbance. Fluid absorbance. It will absorb the fluid in the fecal matters. Okay, it absorb the fluid in the fecal matters, or it will decrease the fluid in the stomach. See, if there is a decrease in the fluid in the stomach, fluid in the stool, the diarrheal effect will be decreased. See, what is the problem with the diarrhea? It is not the it is not that your stool is getting out of your body, right? It's the fluid that is getting out of your body. That is the problem with the diarrhea, right? You may go into dehydration. So the first aim is to decrease the fluid which is going through the through the your through the fecal matters. So first management is to decrease the fluid that is present in the stool. So the wheel in enhance the large intestine to absorb the fluid which is present in the stool. Okay, that is a function of the fluid absorbent. Example is bismuth. Bismuth, bismuth subcarbonate. Okay, that is one drug. Pectin is another drug. Second one, enteric bacterial replacement. Enteric bacterial replacement. See, have you heard? See, the in if there is an diarrhea, then there is normal flora, right? There are normal bacteria in the abdomen, right? Inside your intestine. See, when this diarrhea happens, the normal bacteria will be washed off. And again, this normal bacteria will prevent the diarrhea also. So in such conditions, and again, it helps in the production of the vitamins and such kind of things. So we will give the bacteria. It's in a tablet form, okay, and or it will be in the sachet form. The example is Lactobacillus acidophilus. Lactobacillus acidophilus. Lactobacillus acidophilus. Okay. Third one is motility suppressants. Motility suppressant. The movement will be decreased. Motility suppressants. Have you heard about the drug low motil? That is, it will decrease the motility of the intestine. So when the motility of the intestine is decreased, it will give more time for the fluid to be absorbed. Okay. The low motil is a drug the trade name. The generic name is diph diphenoxylate. This diphenoxylate. Diphenoxylate. Okay. Low motor. Diphenoxylate. Clear. Diphenoxylate. Now, now we have cathartics. Next classification, seventh classification of the drugs. Cathartics or laxatives. Okay, cathartics or laxatives. So the antidiarrheal, the laxative is the just action or opposite action of antidiarrheals. So there is constipation for the patient. So you have to increase the frequency of the fecal matters. So that's why we give the laxatives. Now under that we have intestinal lubricants. Okay, intestinal lubricants. So that's why we drink. You will give the patient the mineral oil, then olive oil. Okay, these are the intestinal lubricants. Usually mineral oil is not used. Okay. B. Second one is fecal fecal softness. If the patient is complaining about 3 days, 4 days of constipation, we'll give fecal softness so that the feces will be softened and it will be removed. Example is docusate sodium. Okay, docusate sodium is an example of the fecal softness. Next, next is bulk forming laxatives. Okay, bulk forming. See, bulk forming laxative is See, why we say that if you're having constipation, you can eat oranges. Why we say that? So why we say that? If you're having constipation, you can eat uh, oranges. Why?
No, yes, exactly.
See, the oranges are having cellulose inside that. Okay, so these cellulose in human body, these cellulose can be digested. Okay, the cow, ox, or such kind of animals can digest cellulose. They are having that enzyme, but humans are lacking the cellulase enzyme, which is important for the digestion of the cellulose. So what happens if a substance is not digested in the body? It will be thrown out of the body, right? Thrown out of the through the intestine. So in that condition, these bulk forming laxative means we'll give the cellulose to the patient. Okay, it will be the powder form. So Isabel husk, what do you have? What do you say in it? So those things are known as bulk forming lactases. Simply the part in that is the cellulose. Okay. So the methyl cellulose, that is example, methyl cellulose. Okay. This is the bulk forming laxative, which means when we consume it, it will be thrown out of the body. So it will be loose also. The cellulose contain fluid. It will absorb the fluid so that it will be soft, and it will give the pressure so that it will be thrown out. And one more thing, the bisacodyl which we use, okay, which is a colon irritant, it is having an what you may have uh, dependency. Yeah, you may have dependency on this bisacodyl, but on methyl cellulose you don't have dependency. Okay, so you can use it for a longer period of time also. But this colon irritant, the colon irritant, example bisacodyl. This bisacodyl will have this dependency, so it is not indicated for a longer period of use for this bisacodyl. And the last classification is saline cathartics, like milk of magnesia. This is what we give now, but not these mineral oils. Okay, we won't give this, but milk of magnesia and magnesium citrate. So these are the things that we'll give now: magnesium citrate as well as milk of magnesia. And what is the main side effects? What is the main side effect? See, the main side effect is dependency. Okay, these drug will be dependent. So if you are taking it for 1 or 2 months, then afterwards, you won't be able to pass feces normally. You might need them tablet for the for defecation. So that's a dependency condition, and also it will affect the vitamin absorption. It will affect your vitamin absorption. It will leads to dehydration. Clear? So those are the problems with the cathartics. Clear? Now, the last foundation in the GA is the vitamins. Vitamins are the important one, right? So we will see each vitamins. We have fat soluble vitamins as well as water soluble vitamins, right? So you know that A, D, E, K, and B and C, fat soluble as well as water soluble vitamins. So we shall see each and every vitamin. So starting with vitamin A. Vitamin A is retinol. Retinol. Vitamin A is retinol. Retinoic acid. Okay. You can draw a bracket like this. And the deficiency diseases. The retinol. If there is a decreased vitamin A, it may cause what? Keratomalacia. Right? It may cause. Guys, this vitamin is important. Usually, the question may come from the vitamin. Okay. Keratomalacia. Keratomalacia is the disease. And again, it may cause night blindness. Okay, it may cause night blindness. Next, vitamin B. So we shall start from, we have vitamin B complexes, right? So vitamin B1. Vitamin B1 is thiamine. See, this the thiamine deficiency is seen in major chronic alcoholic patient because since their intestine will be always present with the alcohol, the vitamins won't be absorbed from this patient. Okay, so that's why the patient will be having uh, your hands will be shaking. All the vitamin deficiencies will be shown by the patient. So vitamin supplementation or injection vitamin is given for chronic alcoholic patient. Okay, so the vitamin B1, thiamine. What is the deficiency disease of the vitamin B1 thiamine? It may cause beriberi. It may cause beriberi and Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome. Okay. Next, B2, riboflavin. B2 is riboflavin. The deficiency disease is eriboflavinosis. Eriboflavinosis. This is B3, niacin. Guys, this vitamin B complexes are important. Okay, they'll only ask the thiamine drive. No, they won't ask B1, B2. The question will be like thiamine, riboflavin, and niacin. Okay, what is the deficiency disease of niacin? You may have pellagra. Next, there is no B4. We can have B5. Pantothenic acid. Pantothenic acid. It may have paresthesia, numbness. The deficiency will leads to numbness. Oh, B6. Pyridoxine. The deficiency disease will leads to peripheral neuropathy. Peripheral neuropathy. Clear? Next is B7. Guys, B7 is also known as vitamin H. Okay, it is also known as vitamin H. Biotin. See, the decreased biotin will lead to decreased hair growth. Decreased biotin will lead to decreased hair growth. B9. B9 is foliate. Neural tube defect. The deficiency of vitamin B12, the foliate will lead to neural tube defect. Then vitamin B12. What is vitamin B12? It is cyanocobalamin. Cyanocobalamin. What is the deficiency? So if say, B12 is present, absent, or deficiency of vitamin B12, it causes pernicious anemia. Guys, this is very important. Pernicious anemia. And also causes megaloblastic anemia. Because megaloblastic anemia. Next, vitamin C, ascorbic acid. Ascorbic acid. Scurvy. See, vitamin A, which is the rich source of vitamin A? I just forgot to say that. Which is the rich source of vitamin A? The rich source of vitamin A is, kindly write this also. The rich sources from where you can get this vitamin A. Carrot is a rich source of vitamin A. Spinach. Spinach is a rich source. Then dates. Dates is a rich source. Ragi. Ragi is a rich source of vitamin A. Now, what about vitamin B complexes? Vitamin B complex. Green leafy vegetables. Green leafy vegetables is the rich source of vitamin B. Now, what about C? The main rich source of vitamin C is gooseberry. Gooseberry is the rich source of vitamin C. Next, vitamin D, cholecalciferol. Cholecalciferol. See, if vitamin D is absent in children, they may have rickets. Okay, in children they may have rickets, and in adults we have osteomalacia. In rickets in children and osteomalacia in adult. Rickets in children and osteomalacia in adults. Vitamin D deficiency. Okay, vitamin D deficiency will lead to rickets in children and osteomalacia in adults. So, which is the rich source of vitamin D? Simply the sunlight. And vitamin E. Vitamin E is alpha tocopherol. Tocopherol. The chemical name of vitamin E, alpha tocopherol. See, if vitamin E is absent, if there is a deficiency of vitamin E, it leads to sterility. Okay, it leads to sterility. And conduction system of the neurons. The conduction system will be impaired. Conduction system of neurons. Conduction system of the neurons. Almond. Almond is a rich source. Pumpkin seeds. Okay, rich source of vitamin E. Almond and pumpkin seeds. Next, we have vitamin K. Vitamin K, phylloquinone. Phylloquinone. If vitamin K is absent, what happens? It leads to bleeding disorder, right? Bleeding disorder. See, this vitamin K, usually the vitamin K is produced by the bacteria which is present in your intestine. Okay, that's why we give vitamin K injection to a newborn baby. Why? The intestine will be sterile. The baby's intestine will be sterile. There is no bacteria inside the baby. When the baby's when does the baby's intestine gets bacteria? It'll get bacteria soon after it takes food from the outside area, which means when it takes food from its mother, when the child start taking free feeding, breastfeeding from the mother, the bacteria comes into the intestine of the baby. Okay, so that's why we give vitamin K to the newborn patient. Okay, There is no vitamin K produced in the baby's body, and the deficiency of K will lead to bleeding disorder. From where does the baby have a bleeding? Through the umbilical cord itself. Okay, so that's vitamin K. Next, we have vitamin P. It's flavonoid. Vitamin P, flavonoid. If vitamin P is decreased, it leads to depression. Okay, it will leads to depression. And the rich source is grapefruit. Grapefruit is a rich source. Next is vitamin R. Ritalin. Ritalin is the name of vitamin R. It is important for the brain function. Okay. So these were all about the medicines. Okay. So guys, are you having any doubt so far?